Hi, welcome to this hair care initiative by IPCA. I'm Monu Sharma. It's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. It used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems appearing at a younger age. It is not uncommon now to see 25 to 35-year-old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided. Today, we have with us Dr. Sumit Kaur. She is well-known dermatologist and has been practicing medicine for over many years now. She's MBBS MD specializing in dermatology, cosmetology, and gynecology. Currently, she is practicing as consultant dermatologist at Skin Molecular Clinic, Lajpat, Nagar, below Sitzram Bhartiya Institute. Dr. Kaur has dedicated her career to diagnosing and treating a wide range of skin and hair conditions by providing personalized hair care services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor is also aware of the need for the patient awareness and education about hair problems and has spent a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for spending a valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Thank you so much for inviting me and thank you so much for that great introduction.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया सो आज हम बात करने वाले हैं हेयर केयर इन करंट सिनेरियो एंड whenever we talk about hair care in current scenario the very common problem which is faced by all of us irrespective of gender and age is hair loss. So doctor, with your profound experience, can you please enlighten us today like what's normal and when to be concerned for?
Okay. Hair loss, as told by a lot of patients, is sometimes not that severe. So,
Mm-hmm.
100 hair falling per day is considered to be normal. But
Mm-hmm.
if you anytime feel that they are falling on everyday basis and they are falling much more than I would call as a number of 50 to 100, sometimes up to 200 is also normal on the days you are washing your hairs. But if they're falling on a routine basis, if they're falling over a prolonged area, or if you're falling from a specific area in the scalp, suppose you are seeing a patch, then definitely it is not normal. And supposedly you have gone sick, or you have been admitted in the hospital, or you have
Mm-hmm.
been under severe stress. After that, diffuse hair fall occurs, then that is also not normal. And that is somewhere where you need medical attention.
ओके मतलब जो सब कंप्लेन करने लग जाए तुम्हारे बाल गिरे हर जगह मतलब डॉक्टर के जाना चाहिए.
हाँ, जब आपको विजिबल हेयर लॉस लगे या फिर आपको लगे कि ये मेरे रूटीन हेयर लॉस से बहुत ज़्यादा है, 100 इज़ जस्ट अ नंबर, you don't have to count 100 because somebody's hairs are short, somebody's hairs are long and जो उसका साइकोलॉजिकल इम्पैक्ट होगा उतने ही गिरे हुए बालों का वो अलग-अलग होगा डिपेंडिंग ऑन कि आपके बाल की लेंथ कितनी है। ज़्यादा लेंथ होगी तो आपको लगेगा कि मेरा तो बहुत ज़्यादा वॉल्यूम निकल गया है, बट नंबर उतना ही रहेगा। सो नंबर इज़ जस्ट अ क्राइटेरिया. But the thing is, if you feel it is much more than your routine hair loss, then you should consider visiting a dermatologist.
Okay, doctor. So, doctor, now that we know what's normal and what are those alarm signs, so another very common questions like जिनको hair loss हो रहा होता है वो यही पूछ रहे थे कि मुझे क्यों हो रहा है. तो like what are those general causes of hair loss?
Okay. So मुझे क्यों हो रहा है hair loss? It depends on your age. It depends on your gender. It depends on, like I said, any stressor or anything you're undergoing. So one of the most common causes of hair loss in our country is nutritional deficiency.
Mm-hmm.
Okay, and a lot of people are deficient in some basic nutrients and that keeps on causing somewhat hair fall, like, and sometimes whenever there is a stressor,
Mm-hmm.
whenever your body is under stress, उसके बाद एक severe hair fall होता है, that is telogen effluvium. तो
Mm-hmm.
उसमें भी आपके nutritional deficiency का ही major role रहता है.
Mm-hmm.
Another causes the pattern alopecia. Males में you know it is male pattern baldness. Females में it is not that much common, but
Mm-hmm.
male it is androgenic alopecia, which has hormonal component, which has genetic component. So these two things are something which we see very very commonly. Telogen
Mm-hmm.
effluvium and pattern hair loss. But इसके अलावा जैसे if it is a baby, then alopecia areata is very common, where you see those patchy areas of hair loss कहीं कहीं पे इट इज मोस्ट कॉमनली डायग्नोज इन आवर कंट्री। जब बच्चा जाता है बार्बर के पास और वो बाल कट कर रहा होता है, तब पता चलता है कि स्कैल्प में एक बाल पैच है, ठीक है।
Yeah.
एंड even the fungal infection, the hair loss caused by the dandruff, that is
Mhm.
seborrhea, excess seborrhea on your scalp. So all these are common causes, but out of these, two things which are very very common is like telogen effluvium and your pattern alopecia. और
Okay, very
आपको
interesting.
क्यों हो रहा है, आपको क्यों
Mhm.
हो रहा है, वो एक एनालिसिस करने के बाद ही पता चलेगा। लाइक
Mhm.
आपका पैटर्न क्या है हेयर लॉस का, कब से हो रहा है, एसोसिएटेड
Mhm.
कंडीशंस क्या है, कोई कोमोर्बिडिटीज है साथ में, कभी कभी ब्लड वर्कअप भी करना पड़ता है कि कुछ
Mhm.
न्यूट्रिशनल डेफिशिएंसीज है या नहीं है। एंड
Mhm.
समटाइम्स वी नीड टू डू अ dermoscopy, that is trichoscopy also, to see the
Mhm.
pattern of hair loss, to see the signs there कि
Mhm.
स्कैल्प में क्या साइंस विजिबल है आपके, टू मेक अ डायग्नोसिस।
Okay, very interesting, doctor. So, doctor, like आजकल तो हम सबका lifestyle is like totally like very busy and जो मिलता है हम वो खा लेते हैं. We don't pay attention to that. So, can a person lifestyle play a role in hair loss?
Yeah, a lot. Like it
Mhm.
is actually a lifestyle where we are seeing the trend of hair loss is shifting.
Mhm.
10 years down the line, जिस hair loss को हम देखते थे 30-40s में, वो आजकल हम और जल्दी early age में देख रहे हैं. So
Mhm.
thanks to our lifestyle, the diet we are eating,
Mhm.
and the stress level is so high. तो आपका जितना stress level high रहता है, उतना आपका body में oxidative stress ज्यादा होता है. That all contributes to hair fall.
Mhm.
And some people have very rigid eating habits. ये नहीं
Mhm.
खाना, वो नहीं खाना. Some people are too much workout enthusiast. तो
Mhm.
ये सब सिनेरियोज एक्सट्रीम सिनेरियोज हैं जिसमें कि आपका हेयर इज अ ग्रोइंग ऑर्गन, राइट।
Mhm.
उसका जो हेयर फॉलिकल है उसमें लॉट ऑफ एक्टिविटी इज गोइंग ऑन. सो यू
Mhm.
नीड द राइट डोज ऑफ vitamins there. You need
Mhm.
the right environment there for it to proliferate and grow. And if
Mhm.
you are continuously in the stress, if your diet, lifestyle, your habits, hair habits are not up to the mark, then definitely that has huge role in your hair loss.
Very
Even the
interesting.
pollution, even the
Yeah.
pollution in current
Even the
scenario.
position. Yeah. Very true, doctor. So, doctor, like, yeah, like now that we know the causes and lifestyle, and in this era of internet information, people are like quite confused that मेरे लिए right treatment क्या है? So, can you please enlighten us, like, what are those medical treatment available for hair loss, like surgical, non-surgical, or any other like topical or oral?
Mm. Okay. Before surgical treatments, we have medical treatments.
Mm-hmm.
Okay. मेडिकल ट्रीटमेंट इंडिया है, बहुत सारे लोग तो घर पे ही करते रहते हैं. आई वुड से कि इट्स बेटर एज अर्ली एज यू गो टू द डॉक्टर, द मोर हेयर्स यू आर एबल टू प्रिजर्व. if you are diagnosed timely, rightly, and आपका जल्दी ट्रीटमेंट शुरू हो जाए, it's always better. So
Mm-hmm.
we have medical therapies, we have therapies like, you might have heard of peptides, you might have heard of minoxidil, which
Mm-hmm.
increases the circulation in your scalp, and you might have heard of even topical finasteride. So we have lot of things working on your hair roots to strengthen up your hairs, to improve your hair quality, and to cause new hair growth. If the topical therapy does not work, then we switch to oral therapies, and there's a lot of role of nutrients also.
Mm-hmm.
And if the oral therapy is also not working up to the marks,
Mm-hmm.
then comes the role of the surgery. That is a hair transplant.
Yeah.
Okay, but to do hair transplant, like somebody should be healthy and be having a good reserve of hairs,
Mm-hmm.
जिसमें से बाल आगे लगा सके. For
Mm-hmm.
those people who do not have that hair reserve, or for those people who are not appropriate to undergo a big surgery, or those who do not want to go for surgery, then comes the camouflage options. Like we can do the scalp micropigmentation. It's kind of a tattooing thing. It will give you a camouflage effect. कोई दूर से देखेगा तो उसे लगेगा कि बाल हैं, but आपको पता चलेगा कि बाल नहीं है. It's a
Mm-hmm.
small procedure. And
Mm-hmm.
then we have, hair patches, hair
Mm-hmm.
extension. So all these things are there. But
Mm-hmm.
a lot of people actually switch to the last options without thinking कि पहले क्या हो सकता है.
Mm-hmm.
So medical treatment is always first. Your analysis of the disease, and you being treated by a doctor properly, then you go to all these options. अगर पहले वाली चीजें काम नहीं करती हैं.
Okay, very interesting, doctor. Like there are so many different kind of treatments, and it is very important कि हम डॉक्टर के पास जाएं और पहले पूछें कि हमारे लिए राइट ट्रीटमेंट क्या है. सीधा ही सर्जरी या फिर सीधा ही कुछ और नहीं करना चाहिए.
Even if you go for a transplant or something, the medical treatment continues with that. If somebody is not compliant with the medical treatment, तो transplant का भी success rate जो होता है वो कम हो जाता है. So medical therapy is the most important therapy.
इंटरेस्टिंग डॉक्टर. सो डॉक्टर एक वर्ड है, हम न्यूट्रिशन के ऊपर इतना बात कर रहे हैं, तो एक वर्ड है न्यूट्रास्यूटिकल जो आजकल सब लोग बात कर रहे हैं, एंड एवरीवन इज लाइक फॉन्ड ऑफ दिस वर्ड कॉल्ड न्यूट्रास्यूटिकल. सो व्हाट इज दिस न्यूट्रास्यूटिकल एंड इज देयर any role of nutraceutical in hair health?
So nutraceuticals are your compounds. Basically, they are derived from food only, but they have this medicinal value. They do have role in hair health. Like lot of things. You have isoflavones, sapamito, you have rapeseed extracts. Things have role. One thing is they will help you fight the oxidative damage. Second thing is some of them are typical inhibitors of some enzymes which are working to increase the miniaturization or increase the hair fall. So definitely का रोल है, और आजकल बहुत सारी जो ओवर द काउंटर भी अवेलेबल हो गई हैं. So we supplement sometimes depending on the patient, like if there is some deficiency, then we also supplement. They do have role, but those things are not sufficient. Like I said, you have to go through this holistic approach. बाकी topical therapies and बाकी सब भी add on करना जरूरी है.
Okay, very interesting, doctor. So, doctor, like आजकल ये मतलब जब न्यूट्रास्यूटिकल न्यूट्रिएंट्स की बात कर रहे हैं, तो कुछ लोग होते हैं जो मैक्रो न्यूट्रिएंट्स बोलते हैं, कुछ माइक्रो बोलते हैं. So, can we just like how the plate should look like and what is the role of these micronutrients in hair health?
Okay. See, lot of micronutrients have role in your hair growth. Hair growth as in hair cycle. जो आपका हेयर बाहर निकल रहा है, जो बाल बन रहा है, उसका जो अंदर एक्टिविटी है ना, उस एक्टिविटी के लिए you need DNA, you need lot of micronutrients there. But most of them are almost supplemented through our diet. But there are माइक्रोन्यूट्रिएंट्स जो प्रॉपर सप्लीमेंट नहीं हो पाते हैं, वो हमें बाहर से लेने पड़ते हैं. जैसे कि if you see our population, most of us are turning out to be vitamin D deficient, vitamin B12 deficient, iron deficient, ferritin. Ferritin is very important for your hairs क्योंकि वहाँ पे एक माइटोसिस चल रहा है पूरा. तो कुछ चीजें whenever a patient comes to us, there are few things which we get tested, and when they turn out to be deficient, we supplement them with those things. And then there are few things which are okay to take on a dietary basis, and that is subject for supplementation. So your plate should look like having a full meal. It should be a combination of your some carbohydrates, but definitely good protein rich diet matters, and definitely green leafy vegetables, foods rich in iron, and foods rich in antioxidants. That is very good. You should be taking fresh meals. And I would say Indian home cooked जो diet है वो अपने आप में सफल और sufficient है. अगर आप कोई भी monotonous food नहीं खाते हैं, then it is well and good. If you keep rotating, if you keep adding fruits, cereals, pulses, everything to diet, then that is good enough.
वेरी इंटरेस्टिंग डॉक्टर. सो डॉक्टर लाइक आजकल ये जो लोग न्यूट्रिएंट्स लाइक प्रॉपर न्यूट्रिएंट्स नहीं होते हैं, डेफिशिएंट हो जाते हैं, देन दे बाय दीस न्यूट्रास्यूटिकल्स फ्रॉम like online and they keep popping the pill. So is it required to take these nutrients as per gender RD requirement under the supervision of doctor?
I would say under the supervision of doctor, क्योंकि how would you know कि आपको किस चीज की डेफिशिएंसी है, कौन सा आपके लिए राइट है या नहीं है. एंड मेल एंड फीमेल थोड़ा आरडीए भी डिफर करते हैं, स्पेशली लाइक आयरन. Females require iron more. They are more ferritin deficient because of the regular menstrual cycles as compared to males. Protein intake थोड़ा सा मेल को ज्यादा चाहिए होता है. तो over the counter, it's okay to take it for some time, maybe for 1 or 2 months, but it is always better rather than spending so much on those medicines. It's always better to consult a doctor and मेक अ होलिस्टिक अप्रोच कि क्या सब करना है, क्योंकि ओनली वन थिंग इज नॉट गोइंग टू बी सफिशिएंट. दे हैव रोल बट दैट डजंट मीन दे आर 100% करेक्टिव.
वेरी इंटरेस्टिंग डॉक्टर. सो डॉक्टर, हमने हेयर लॉस की बात कर ली, हमने लाइफस्टाइल के बारे में बात कर ली, ट्रीटमेंट के बारे में बात कर ली. एक और वेरी कॉमन प्रॉब्लम जो हम सब फेस करते हैं वो है डैंड्रफ. सो क्या डैंड्रफ से हेयर फॉल हो सकता है?
हाँ, डैंड्रफ से भी हेयर फॉल हो सकता है, बिकॉज जितना डैंड्रफ बेसिकली है क्या, आपके स्कैल्प में जो ऑयल ग्लैंड्स है वो जो ऑयल प्रोड्यूस कर रही हैं वो ऊपर जाके डिपॉजिट रह रहा है. बट कमिंग टू एक्सेस डैंड्रफ, उसके साथ में आपके ऊपर एक फंगस रहती है मेलासीजिया फर्पर, उन सब का रोल कभी कभी सेबोरिक डर्मेटाइटिस हो जाता है. सो व्हेनेवर इन्फ्लेमेशन इन द स्कैल्प, तो इन्फ्लेमेशन से हेयर फॉल होगा ही होगा जब भी आपको एक्सेस डैंड्रफ होगा. बट hair fall is reversible. When your inflammation is gone, that hair fall is reversible. So you should be like, most of the people know that they use all this anti-dandruff shampoo, ketoconazole shampoo. So depending on कि आपको कितनी severity है scalp में उस सेबोरिया की, आप उसके हिसाब से अपना shampoo use कर सकते हैं, and that itself is sufficient to take care of that most of the times. If not, then yeah, you need an expert opinion.
इंटरेस्टिंग डॉक्टर. सो डॉक्टर, लाइक लाइफस्टाइल में एक तो न्यूट्रिएंट आ जाता है, दूसरा एक स्ट्रेस भी आ जाता है. सो इज देयर एनी इम्पैक्ट ऑफ स्ट्रेस इन हेयर?
Yeah, of course. Stress is like आपका स्ट्रेस लेवल ज्यादा होगा तो आपका कोर्टिसोल लेवल ज्यादा होगा. आपका जो बॉडी है वो एक फाइट और फ्लाइट मोड में चला जाता है. तो इट कम्स टू अ स्टिल फेस, तो आपका जो हेयर साइकिल है वो भी स्टॉप हो जाता है. एंड दैट इज व्हाई वो जो आपका स्ट्रेस लेवल बहुत ज्यादा होता है, उसके बाद आपके बाल एक फेज टीलोजन फेज में एंटर करते हैं जहाँ पे हेयर शेडिंग होती है. तो स्ट्रेस का डेफिनेटली बहुत बहुत इम्पैक्ट है बालों के ऊपर, बिकॉज इट्स अ ग्रोइंग थिंग. सो स्ट्रेस आएगा तो वो रेस्टिंग में चला जाएगा, एंड देन उसके बाद हेयर फॉल होगा.
वेरी इंटरेस्टिंग डॉक्टर. सो डॉक्टर, लाइक जब हम स्ट्रेस में होते हैं तो एक घरेलू नुस्खा जो हर दादी नानी देती है वो है कि ऑयल का मसाज करना. दे आल्सो लाइक भर के ऑयल लगाओ तो बाल लंबे हो जाएंगे. So what is the fact behind this? Like oiling hair is being banned.
Okay, so as such, we dermatologists do not recommend oiling of the hairs because आपकी scalp enough oil produce करती है, तो हमें जरूरत नहीं होती. But oil is a very good conditioning agent, so you can put it on your shafts and then you can wash it off because it works as a very nice conditioner. Also, contrary to the fact कि आपकी scalp को oil नहीं चाहिए, when you do oil massage, you end up increasing the circulation of the scalp. तो उससे हेयर ग्रोथ में हेल्प तो होती ही है. बट सपोज यू ऑलरेडी हैव एन ऑयली स्कैल्प और ऊपर से आपने और ऑयल लगा लिया, तो जो आपका बिल्टअप मटेरियल है, जो वहाँ पे सारा बैक्टीरिया फंगस सब कुछ रहना है, वो बढ़ जाएगा, फिर आपको हेयर फॉल हो जाएगा. So you can use oil, but you use it wisely for conditioning your shafts and also for massaging because it does have this relaxation purpose, increases the blood circulation also. So I would say हाँ, साउथ इंडिया में बहुत हेल्दी बाल रहते हैं सब लोगों के, वो काफी ऑयल लगाते हैं. बट आई वुड टेल यू साइंटिफिकली वी डू नॉट नीड ऑयल.
Okay. Very interesting. Like just for some kind of conditioning. Otherwise, hair say oil say hair growth होगा कि नहीं, which is like a question mark. Anyways, doctor. So now my favorite part, doctor. Can you give us some important tips for healthy hair?
Okay, important tips for healthy hair. Keep your hair clean. Clean as in wash them जितनी आपको जरूरत हो. If you are somebody with very oily hairs, आपका scalp बहुत ज्यादा oil produce करता है, तो अगर आपको daily wash करना पड़ रहा है तो आप daily wash करो. अगर आपके बहुत ऐसे dry सा scalp आपको लगता है कि इतनी जरूरत नहीं है, तो आपको once a week wash करना पड़ रहा है तो आप once a week करो. You do it as you need it. Okay. Then I would say the salon procedures should be done to the minimum extent. जो लोग कलरिंग, पर्मिंग, ब्लो ड्राई बहुत ज्यादा करते हैं, तो ये सब केमिकल है, इस सब में हीट है, ये आपके बाल को डैमेज तो करता ही है. तो ट्राई टू अवॉइड देम एज मच एज पॉसिबल. बट इफ लाइक समबडी हैज टू डू इट, देन के बाद अच्छी कंडीशनिंग करना, उससे पहले अच्छी कंडीशनिंग करना आपके शाफ्ट को रिपेयर करने में हेल्प करता है. good diet has a role, good lifestyle has a role. अपना stress level कम रखें. And there is a small tip कि जिन लोगों के straight hairs होते हैं उन्हें wet combing नहीं करना चाहिए, क्योंकि उससे आप उनका hair because your hair is very fragile when it is wet. बट अगर आपके कर्ली हेयर्स हैं देन वेट कॉम्बिंग इज द बेस्ट थिंग, क्योंकि जब वो वापस से कर्ली हो जाएंगे तो आपको कॉम्ब करने में ज्यादा डिफिकल्टी रहेगी. एंड डूइंग आई थिंक डूइंग ऑल दीज थिंग्स and depending on your season, if you are in tropical area, if you are in lot of summer season, then again washing is more frequently recommended. If you are somebody who works outdoor, then try to cover your hair with some hat or some scarf, क्योंकि यूवी एक्सपोजर से भी आपका बहुत ज्यादा हेयर डैमेज होता है. So that's all. Cleaning and conditioning. These two things are very important.
Okay, doctor, this discussion was very informative. I'm sure the viewers have found this session very helpful. So, can I take one or two live audience questions? So, the first question from our audience is, Doctor, there are so many products available like hair oil, serums, and anti-hair fall shampoo. What should I actually look for in these products as I'm 35 years old now?
35-year-old male, what kind of product is asking?
It's like इतने सारे hair oil है, serum है, anti hair fall shampoos है. आफ्टर
Hmm.
35 किस टाइप का शैम्पू एक किसी इंसान को यूज करना चाहिए?
Okay, okay. The simple fact is shampoo का काम hair को clean करना है. So you can use any shampoo which suits you. ऐसा नहीं कि उसका ब्रांड चेंज करने से आपका हेयर फॉल कुछ बहुत ज्यादा कम या बढ़ जाएगा, बिकॉज शैम्पू अफेक्ट्स शाफ्ट. इफ यू आर फीलिंग कि इससे मुझे ड्राइनेस आ रही है, देन डोंट यूज इट. एंड देयर इज वन मोर, व्हेन यू शैम्पू योर हेयर्स ना, यू शुड बी पुटिंग इट ऑन स्कैल्प, इन द रूट्स, नॉट ऑन योर शाफ्ट, ताकि वो बालों का लस्टर नहीं खराब करे. So any shampoo which is suitable for you in the market is good enough, because shampoos as such do not affect your hair loss to a great extent.
वेरी
And the
इंटरेस्टिंग.
oil is, I would say, the best oil for your hairs is coconut oil.
Okay. Another question from our viewer is, hi doctor, I'm diabetic and recently doctors added insulin, and since I'm using insulin I'm having hair fall. Should I stop using insulin?
No, 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 because insulin is very important for controlling your diabetes. That should not be stopped. If you are having hair fall, the probable reason behind that is maybe some nutritional deficiency or maybe some other reason. So that needs to be stopped up. Insulin should not be stopped.
Okay.
Insulin as such does not cause hair fall.
It's better he or she don't go to the doctor and
Yeah.
get it checked. Another question from our viewer is, hi doctor, मेरे को अभी recently PCOD diagnose हुआ है और मेरे एंडोक्राइनोलॉजिस्ट ने बोला है कि डर्मैट को दिखाओ, ऐसा क्यों?
जो पीसीओडी है उसका क्लिनिकल मैनिफेस्टेशन आपकी स्किन पे भी आता है इन द फॉर्म ऑफ एक्ने, हर्सुटिज्म एंड हेयर लॉस. तो correcting the PCOD itself correct all of these manifestations. Sometimes it's mild PCOD that is good enough to be managed by simply lifestyle modification. PCOD is a lifestyle disease. But if your for like female pattern alopecia is associated, then definitely you have to do a timely dermatological consult, so that जितना जल्दी हम इंटरवीन करेंगे, आपके फॉलिकल्स प्रिजर्व्ड हैं, उतना जल्दी आपके बाल वापस आएंगे. इन लेटर स्टेज इट डज बिकम डिफिकल्ट टू गेट द हेयर्स बैक.
Okay, so PCOD के कारण hormonal imbalance होता है, and hormonal imbalance can
Right.
also lead to
Yeah, PCOD, all of your insulin resistance, all these causes hair fall. Your hormones, they have a huge role in your in maintaining your hairs.
Okay, very interesting, doctor. So, doctor, would you like to give any take-home message or any other suggestion to our viewers today?
So my take home message are कि your hairs are very big social thing basically. So, and to maintain them, never waste your time. If you are having hair loss, then do not try all those here and there desi nuksas, and don't try OTT products and all. Just visit a doctor, because once your hair loss is to a certain extent, it's difficult to get them back. And the early intervention is always correct. So eat healthy, take a good protein-rich, balanced diet, and if required, then you need to go to the doctor.
Okay. Thank you so much, Doctor. Thank you so much for sharing all your expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found this session very helpful. And thank you so much, Doctor. It was a delight to have you, and thank you so much for your valuable time.
Thank you so much.
So, also thank you to all the viewers for joining us today and asking questions. I hope if doctor have some time in future, we'll take her appointment again, and we can discuss more and enlighten all people like more about skin and hair care. Until then, doctor, take care.
Thank you. You too. Take care. Bye bye.
Bye bye.